The purpose of a nipple reduction is to reduce the length of long or over projecting nipples. So if you have very long nipples that make you self-conscious in clothing and you just don't like how long and projecting they are, I can perform a nipple reduction. And basically how this is done is the very tip of your nipple is you're numb. So you're either numbed up or you're asleep for this. So we can do it under local anesthesia or while you're asleep, usually combined with another operation. If this is all you're having done, I'd recommend just doing it under numbing medicine. But once you're no longer going to feel this, I shave the tip of your nipples off as a graft. So they're very thin, but I'm gonna put them back on. Then I remove the excess length of your nipple down to an attractive or normal nipple length, and you can tell me what you want. We'll hold the ruler up to your nipples before surgery, and you can tell me how long or projecting you want them to be. And then I'll put the cap or the graft, the tip of your nipple back on as a graft and sew it in place. And that's about it. So it's a fairly straightforward procedure. I think that it is often overlooked. I think that a lot of women think there's nothing they can do about their long or over projecting nipples, but it is a rather simple operation with very easy recovery. One important point to know is that it will affect your ability to breastfeed. There's a good chance you will not be able to breastfeed after that because the ducts could become disrupted and scarred. The other thing is that the very tip of your nipple may have altered sensation. Usually the sensation comes back to mostly normal because the nerve endings that are cut grow back into that graft or the tip of your nipple that I put back on. So oftentimes the nipple sensation ends up the same as what it was before, but it could be altered as well. Another thing is the pigment could be altered. Sometimes that tip of the nipple that is healing and grafted back on will lose pigment. Usually that pigment will come back with time. If it does not, I will have you see one of our tattoo artists. We have tattoo artists that tattoo nipples on our breast reconstruction patients, so they can simply use the same techniques they do to create nipples from nothing. It's much easier. All they need to do in your case would be to add a little bit of pigment to the tip of your nipple so it matches the rest of your nipple areola complex. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.